Hello, everybody. Welcome to another video of Deeper Than the Headlines. I am CJ Wolf for Healthicity. In our Deeper Than the Headlines series, we take a headline in compliance or coding, usually enforcement of some sort, and we dive a little deeper to give you a little bit more details beyond that headline. The headline I like to talk about today happened in Georgia, and it was a $1.6 million settlement. Now, remember, these are usually allegations brought forth by a key TAM relator, or a lot of people call them whistleblowers. And so these are allegations. These rarely go to trial, and the company settled. In this particular case, it was a company that was in 4 states. The action was out of Georgia, and the company was an urgent care chain, and they settled for $1.6 million. And the allegation was that they were upcoding their E&M levels, specifically during COVID. They were choosing level 4, that's either a 99204, or they were choosing level 5, 99205, and then similarly 99214 and 99215, depending on what category of E&M code they were reporting. But that there was some sort of reflexive or automatic decision making that if a person comes in suspected of COVID, they're going to be a level 4. If they test positive for COVID, they're going to be a level 5. Now, a lot of us know that during COVID, there was, this severe um, spectrum of variation. Some people we know, many people died of COVID. And so it can be very serious. But we also know that there were many people who had COVID and they didn't even know it, and they had no signs or symptoms. So testing positive is not necessarily what, at least in this lawsuit, in this allegation, is really what should be used to choose that highest level. Now, this was a chain of about 50 to 60 urgent care clinics. They were in 4 states, I think Georgia, Florida, Maryland, Alabama, something like that. And what was really interesting, so a little bit deeper than that headline, is that they were using the new 2021 E&M revised guidelines. So remember, back in 2021 and then again in 2023 for a different range of codes, the E&M guidelines were changed. And before 2021, you may remember the 1995 and 1997 E&M documentation guidelines, where we were using history and physical exam and medical decision making to determine the level if you were not choosing the level off of time. Well, in 2021, which is when that was in COVID, during COVID, these guidelines changed for the outpatient office outpatient visit codes. And so it was really interesting to read the court records in this particular case. This case, actually, the claim or the complaint that was filed by the whistleblowers, and the whistleblowers, there was a nurse practitioner and a physician who both worked at this practice. They included the slide deck that included the training that all of the providers in this organization received. Again, these are all allegations. But according to that document, they had the slide deck, and they showed that with their EMR, what boxes to click and what boxes to check if somebody was possibly exposed to COVID, and then they tested negative, or if they had symptoms of, a lot of us know cough and weakness and headache and muscle aches and those sorts of things. So they had symptoms and possible exposure, but then tested negative. And so those, and regardless of the severity of that patient, again, some patients might be legitimate level 4, and some would not be. So just testing positive should not have been the threshold, is what the argument was about in this case. And then similarly, they also showed on this slide deck, and this is all in the court records, they show screenshots of their EMR and what the doctors are supposed to choose as far as these new E&M guidelines for if a patient tested positive for COVID. Again, a patient can test positive for COVID and have had no signs or symptoms, or they may have had mild signs or symptoms, or we all know that people with COVID perished. And so it's patient specific, not whether you test positive or not. And so that was what the allegations were. This organization ended up settling for $1.6 million. Again, it did not go to trial. So pretty interesting, digging deeper into these court records and looking at what's happening with some of these cases. I hope you like these. If you have a case or a story that you'd like us to look into a little bit more, as much as that information is publicly available, we'd love to do that. Thanks for listening to Deeper Than the Headlines.